but the education is important and the support right now. And again, public awareness. And you get that public awareness through fundraisers, of course, because some people go, well, you know, I'm going to go walk because my company's going to walk in this walk. But in the process, we're hoping that the more fundraisers we have, of course, there's going to be money raised to go to programs and research, but also the awareness.
You know, Ms. Smith, I think that she's talked about diabetes, but let's look at it from a clinical, from a medical point of view. Exactly what is diabetes, and what are some of the things that are generally associated with it, and how could members of our audience this morning who might perhaps wonder about whether or not they have the disease, what information can you give us as a diabetes educator about some of the causes of that?
We know that diabetes is a very simple in definition, very difficult in treatment and management. Definition is that it's the body's inability to handle food correctly. The body is either not making or producing insulin, or it's not using the insulin it produces effectively. Insulin is often thought of as a drug you purchase at the pharmacy or your physician puts you on. Our bodies make insulin. We use that to handle the blood sugar that we need for energy. The brain uses sugar for a source of energy. It cannot produce it, nor can it store it. So it's a misconception to think that we want to get rid of sugar in our blood. A lot of folks think that's a negative. We have to have that. A lot of people have a thought that it's just a touch of diabetes or borderline diabetes, and I want to dispel that thought. It's very important, if you have a disease, to come to the fact and the realization that this is a disease. It's a chronic disease. As Dudley pointed out, we don't have a cure. We know how to manage. We know more about diabetes now than we have ever known in the past. We still don't know enough, so we're still learning. But it's important to do what we can to manage it now. We know that the Diabetes Complications and Control trial was initially a 10-year study to look at what does management do for long-term complications. Is it important for me to keep my blood sugars in good control, or does it really make any difference? And yes, it does make a difference. We know that we can put off complications by up to 50 to 75% if we look at a three-step approach. Diet is very important, exercise is very important, and for some folks it's also the addition of drugs, whether it's an oral agent, which is not insulin, but an oral agent, or insulin itself. So it's a multi-dimensional aspect of care. A lot of people don't realize they have diabetes. Unfortunately, we have a lot of folks in the audience that may have symptoms that they're putting off as something else. I'm tired all the time, and my eyes are bothering me. I just haven't had them checked lately.
Those are symptoms of...
These are symptoms. And taken singly, they may not look like much. When we group them together, look at them collectively, we know that extreme fatigue, tiredness, visual disturbances, there may be an excessive thirst. Patients or people may find themselves going to the bathroom a lot. There may be signs that they haven't really thought of as being anything other than, well, I've just been working too much, I've been sitting at the computer too much, I don't have time to do this, the family needs this or whatever. We find a lot of folks that are diagnosed later in life are only diagnosed because they went to the doctor for something else. They went for their annual physical, they went because they had a broken ankle, or maybe they had some major complication, and at that time the diagnosis is made. So it's real important that folks are, number one, made aware of signs and symptoms, and number two, that they act on those signs and symptoms and not tend to brush them off. The American Diabetes Association has a wonderful little paper test, and it says know the score. There's some questions that we ask. If it's a female, have you had a baby that weighed 9 pounds or more? That's a pretty good indication that maybe we need to look at something. Do you have some visual
what
changes?
relationship does that have with a 9-pound baby or more?
Lots of females will find that they have no problems with food intolerance or glucose intolerance until they become pregnant. Pregnancy is a wonderful affair for most of us. It does put a major stress on the body. And during that period of time, a lot of females will find that they have glucose intolerance, or they're unable to manage, their body's unable to manage the extra stress and strain. This is what we call gestational diabetes. And we look at baby size here. The higher the mother's blood sugar during pregnancy, the larger the baby usually. And we try not, 9-pound babies are pretty good sized babies.
It is.
And we're looking at,
Do they know the connection yet?
a lot
Why?
of it is, if we're looking at the mother's blood sugar being higher, mother's blood sugar passes over to the baby. Mother's insulin does not. So the baby's getting all this extra sugar. He's
Nutrition.
producing insulin to take care of this, and in the meantime, he's just growing and growing and
I
growing.
gotcha.
A bigger baby is not always a healthier baby. It also increases the risk for preterm delivery. We know that babies need to stay in the womb as long as they can so that their lungs are going to develop. And if we find a large baby, that's going to lead to a longer labor for mother. It's also going to lead to an increased likelihood of a preterm delivery. Once a mom has delivered a baby that's 9 pounds or greater, subsequent pregnancies are more than likely going to see that issue arise again. We know that a great percentage of women that are overweight and do not lose their weight after pregnancy have an increased risk of developing what we call type 2 diabetes. And this may or may not lead to a dependency on insulin, but it overall is the body's inability to manage their food properly. There again, when we talk about food, it's not just the sugar products we're talking about. A lot of folks think if I just don't eat sugar. I'm okay. And we're looking at carbohydrates. We're looking at all the body's functions. When we're looking at breaking down nutrients, it's a whole meal plan that we talk about, and not just avoiding sugar. Sugar doesn't necessarily have to be avoided altogether. It can be included in a meal plan. The days of having a cardboard diet that we used to talk about are non-existent. People with diabetes can have a wonderful meal plan, enjoy all kinds of foods, but we just need to be well educated on what foods are good to eat.
Very good. Ms. Boran, I think you mentioned earlier